Why patients are turning to myofascial release for chronic pain. Hi, I'm Joan Antonio Cool, a registered massage therapist at West Henday Physical Therapy. Living with chronic pain can be exhausting, and sometimes traditional treatments don't fully relieve tension. Today, I'll explain how myofascial release works, why so many patients are turning to it, and how it can help reduce pain and restore movement. What is myofascial release? Myofascial release is a hands-on therapy that targets the fascia, the connective tissue surrounding your muscles and organs. When fascia becomes tight or restricted, it can cause pain, stiffness, and affect posture and movement. This technique gently stretches and releases the fascia, helping your muscles move more freely and reducing tension throughout your body. How it helps chronic pain. Tight fascia can pull on your muscles, joints, and nerves, which often leads to ongoing pain. Myofascial release helps by gently easing the tension, improving blood flow, and getting nutrients to the tissues that need them. It also helps restore your mobility and range of motion and calms the nervous system so your body isn't amplifying the pain. Who benefits and when to use? People who often benefit from myofascial release include those dealing with chronic back, neck, or shoulder pain, headaches or migraines caused by muscle tension, postural pain from sitting or repetitive movements, and conditions like fibromyalgia or widespread muscle pain. Sessions are usually scheduled weekly or every couple of weeks, depending on your needs and which areas are tight or restricted. Chronic pain isn't just about sore muscles. It's often about tight fascia and how your body moves as a whole. Myofascial release is safe, gentle way to restore movement, reduce pain, and improve your quality of life. Reach out to us at West Henday Physical Therapy for a personalized assessment and treatment plan. Let's help you move more comfortably and live pain-free, starting with your fascia. Is myofascial release painful? Most people feel gentle stretching or pressure. It shouldn't be painful. It's designed to release tension without causing discomfort. Can anyone try myofascial release? Most people can, but if you have certain medical conditions like acute injuries, infections, or blood clot risks, check with your healthcare provider first.